Welcome. Today we're going to be discussing the history taking portion of your SOAP note. The first and one of the most important things is developing the chief complaint. You have to ask your patient, why are they here? And it's good to quantify it with how long it's been going on. Diarrhea for a week, how many days it's been going on. And here you're going to be using the patient's terms and not medical terminology. You're not going to say dysphagia times 2 days. After we've established the chief complaint, we're going to go on to the history of present illness. This is truly the story of what is going on. This is where you gather as much information as you can, put it in chronological order, and again, this is a very important part of your detective skills. If you do not have a good HPI, your SOAP note will really suffer from it. That's why we suggest using the OPQRST to help you know what to ask your patient about their chief complaint. It's easy to say to use a chief complaint of pain. So you can ask your patient the onset, what makes it better, what makes it worse, quality, region, severity, timing. All of these questions with the OPQRST are for your symptoms to help you get a better indication and better description of your symptoms. But once you have your symptoms, go ahead and use the acronym VINDICATE. VINDICATE stands for vascular, inflammatory, neoplastic, degenerative, idiopathic, congenital, autoimmune, allergic, traumatic, endocrine, and even psychosocial. Use VINDICATE to help you explore all of your differential diagnoses. Whereas OPQRST helped you get good symptoms, now is the time to get differential diagnoses. Once you have your list of differential diagnoses, use that so that you can ask questions in your HPI specific to those diseases. And you can even use these diagnoses for specific assessment techniques for your physical assessment. Even if you successfully rule out a disease, include that information in your note, and that is considered a pertinent negative. So how do we use this in real life? Let's use the acronym, or let's use the chief complaint of shortness of breath. What is a vascular complaint for shortness of breath? One would be a PE. Inflammatory could be epiglottitis, a neoplastic, lung cancer, and go ahead and think along with me as we're going through this. A degenerative or deficiency would be a COPD or antitrypsin disorder. Idiopathic is something that we caused or what we did. And this would be, an example would be VAP or ventilator-associated pneumonia. Congenital would be a cystic lung disease or something along those lines. An allergic or autoimmune could be asthma. A T or traumatic could be a pneumothorax. E, an endocrine, and again, it's good to note that not all of these may specifically give you a diagnosis for your symptom, but we could stretch it a little bit and maybe call a Cushing reaction related lung cancer, or maybe a thyroid disorder causing overweight and resulting in Pickwickian syndrome. And the last one would be S, or psychosocial. This could be an example of a panic attack. So when you have these lists of possible differentials in your mind given the chief complaint, use those and to determine what questions you're going to ask. If you want to rule out a panic attack, it's simple to ask a past medical history of depression or anxiety. Has this happened before? Even a pneumothorax, when you're asking about the events leading up to it. All of this will help you get better differential diagnoses so that you can be a better detective.